Hello, it's Jayne here from the Calm and Happy Gut, and today I'm going to be answering a really popular question, which is, do I think gut-directed hypnotherapy or the low FODMAP diet works best for managing IBS? Now, yes, I know I'm a little biased being a psychotherapist, but I'm going to talk you through the research studies in this video comparing these two different approaches, and I'm also going to share first-hand experiences from my clients who have tried both. My hope is that by the end of this video, you have a good understanding of the pros and the cons of each so that you can decide which is the right approach for you. So keep watching to find out, and if you want more content on this topic, then make sure you subscribe to this channel. Okay, so in this comparison, I'm going to introduce you to each approach first before going through the pros and the cons of each, and I'm going to start with gut-directed hypnotherapy. Now, I've been a gut-directed hypnotherapist since 2018, and over that time, I've been helping clients from all around the world manage their IBS symptoms without having to change their diet or change their eating habits. Now, gut-directed hypnotherapy is a specialised form of hypnosis which is designed to help manage gastrointestinal disorders such as IBS. It's used because it has the ability to change the signals between your brain and your gut, and in the case of IBS, these signals just aren't working as they should. In fact, the faulty communication happening between your brain and your gut is what is responsible for the hypersensitivity that you are experiencing and the change in your bowel movements, which is resulting in either constipation or diarrhea. Now, a program of gut-directed hypnotherapy doesn't just help with the physical symptoms that you may be experiencing, such as pain, gas, bloating, and those altered bowel movements. It also helps to reduce anxiety and your overall stress levels, and helps you to change how you think and feel about your IBS, which in turn lowers food anxiety. Also helps to break the stress symptom cycle, which is really easy to stay stuck in, and it helps you take back control of those anxiety provoking and those what if thoughts, which have you always expecting the worst to happen. Now, the low FODMAP diet, on the other hand, is a very different approach to managing the symptoms of IBS and is entirely focused on the food that you're eating. The low FODMAP diet is broken into a 3-step process where the first stage is heavily restrictive, where you're cutting out many different FODMAP foods for between 2 to 6 weeks. The second phase is the reintroduction, where you slowly reintroduce different foods over 6 to 8 weeks. And then finally, there is the personalization phase, where you basically establish a personalized FODMAP diet with the help of a dietitian. Now, the low FODMAP diet is designed to be followed temporarily and helps to reduce your IBS symptoms because you're basically eliminating or restricting a group of sugars called FODMAPs, which can cause intestinal distress. Now, I'm not going to get into why FODMAPs can cause IBS symptoms in this video, but all you need to know right now is that when your nerves inside of your gut get hypersensitive, which happens in the cases of IBS, they become hyperreactive, which causes bloating and pain and altered bowel movements. So when you reduce and you remove FODMAPs from your diet, you're actually removing the foods that are causing the nerves to overreact inside of your gut. Now, following a low FODMAP diet usually results in you having a list of foods which are seen as troublesome for you, and which if you cut out or reduce, then your IBS symptoms will also reduce. Unfortunately, the low FODMAP diet can feel as though everything stops and starts on your plate, and it doesn't take into account things like the impact of stress or anxiety on your digestion. You see, there is so much more to digestion than just the food you're eating. For example, how you feel before, during, and after can play a big role in how your body is digesting the food that you're eating. And that's because if you're feeling anxious or stressed about your food choices or about what's going on in your life, then it's going to have an impact on how your digestive system functions. And this all comes back to the gut-brain connection, which I mentioned earlier. And this is important, because if you are in a state of stress, also known as the fight or flight response, your body starts to divert blood away from your digestive system, affecting the muscles in your bowel, causing urgency, spasms, or shutting off all motion altogether. In a state of stress, you can also experience an increased sensitivity to pain. This is why following a low FODMAP diet can result in many inconsistencies, where you can eat a trigger food one day and be in a world of pain, and then eat it 2 days later and be completely okay. So when looking at these two approaches, they both have the ability to reduce your IBS symptoms. And in a randomized clinical trial, gut-directed hypnotherapy was found to be as effective as the low FODMAP diet for treating IBS. Now, this particular study split participants into 3 different groups. First, there was the low FODMAP diet group. Second, there was the hypnotherapy group. And third, there was a combination group where patients were doing both of those things. In all groups, approximately 70% of patients reported improvements in overall symptoms. But interestingly, and perhaps not surprisingly, the patients in the gut-directed hypnotherapy group also reported improvements in symptoms in things like anxiety and depression. What's also interesting to note here is that hypnotherapy outperformed a combination of both therapies and outperformed the low FODMAP diet alone at the 6-month follow-up mark. So what does all of this mean for you? Well, it means it's possible for you to achieve the same level of symptom reduction without having to change your diet. And in addition to reducing the physical symptoms of IBS, it can also significantly help with psychological factors such as anxiety. So now let's take a look at the pros and the cons of each. Again, we're going to start with hypnotherapy. Now, I think you'll agree with me here that the biggest pro with hypnotherapy is being able to manage your symptoms long term without having to go through the stress, the overwhelm and the confusion of changing your diet and following a food plan. There's no complicated food shopping or hours of time spent preparing different foods in advance. Hypnotherapy also helps to reduce or eliminate food anxiety and rebuilds the trust and the confidence in your body, which allows you to start saying yes to social events which involve food and to stop feeling at the mercy of your bowel. I've worked with many clients who have successfully gone back to booking holidays away, taking long car journeys without worrying about the traffic, and eating out in restaurants again without all of that old fear and anxiety. In fact, the hypnotherapy program I take my clients through doesn't just focus on reducing your physical symptoms. It also helps you get back to doing what you love. Now, in terms of cons, hypnotherapy is not magic, and there is a time and energy commitment that's needed from you. There are daily self-hypnosis support sessions to listen to, which are around 20-25 minutes in length, and often I'll give my clients tasks to do weekly in between their sessions. Now, this can include things like tracking your thoughts and practicing deep breathing exercises. Now, when it comes to how quickly you can expect results, everyone is different, of course, but some people feel significant differences in a very short space of time, whilst for others, it can feel a bit longer. I've worked with clients who, after just 3 sessions, went from experiencing terror at the thought of eating out to enjoying fish and chips on the beach with their friends and having absolutely no reaction. Okay, so let's now talk about the pros and the cons of the low FODMAP diet. Now, the pro is that, yes, it can absolutely help to reduce your IBS symptoms, and there are many people who see relief and are content to limit what foods they can eat. But let's be honest, following restrictive diets can be hard. They can also be really expensive, especially if you don't have the time or the knowledge to prepare FODMAP-free meals. This approach can also be the cause of something called disordered eating, where you become more and more anxious around eating out and around certain meal times because you've basically primed yourself to be on the lookout for gut symptoms. This means that you may find yourself saying no to weekends away or to social events because you aren't able to control what you can eat. And one of the biggest drawbacks in my mind is that you just don't deal with those oversensitive nerves and the ongoing anxiety and stress, which can actually cause your stomach to become more and more reactive, meaning that over time your list of safe foods becomes smaller and smaller. I see this all of the time with the clients I work with who have been on the low FODMAP diet for far too long. So when it comes to you and your IBS symptoms, should you follow the low FODMAP diet or should you undergo a program of gut-directed hypnotherapy? Well, unfortunately, I can't tell you what to do, as I would really need to understand your own personal situation. But I would encourage you to consider your tolerance for restricting food levels. Also have a look at your stress levels and how much of a role anxiety is playing in your IBS and in your relationship with food. Because if you find yourself feeling anxious or worried around meal times and feel as though your world is getting smaller and smaller trying to control what you're eating, then I would strongly encourage you to explore a program of gut-directed hypnotherapy. If you would like to learn more about my own programs and learn about IBS resources, then you can check out the links down below this video. Okay, well that's it for now. Thank you for watching. Let me know if you've got any questions just down below this video, and I will see you in the next one. Until then, stay well, and I will see you soon.